This is me scanning my room for my bedside assessment. My patient. Okay, so before going into any patient's room, you would perform hand hygiene. Once I'm in the room, I would introduce myself to any family members or visitors, and then introduce myself to my patient, let him know who I am and what I am there for. So hi, my name is Maria. I'm a student nurse with Brightpoint, and I'm here to do your bedside assessment today. Is that okay?
Yes.
Okay, and you would also want to identify your patient using their bracelet, so I'm just going to check your two identifiers on here. Can you tell me your name and date of birth?
Yes, it's Matthew Catchwar. It's 4/21/67.
Thank you. You would also want to make sure that your patient is alert and oriented. You can ask them a few questions to do this. Make sure they're oriented to themselves, to their situation, time, place. You can also ask them who the current president is or what is the next big upcoming holiday. So, sir, can you tell me where you are?
I'm at Chippenham Hospital.
And what time is it right now?
8 o'clock.
Alrighty. And what brought you in today?
I had pain, kidney stones, I believe.
Okay. So from there, I would also, while I'm in the room, wanting to make sure that the patient is in a safe position, so the bed is in its lowest setting. We have all side rails up but one. I would also want to check on any tubes or wires or equipment that are currently in use. So if the patient was on oxygen, I would check on the flow. I would check on their IVs, the site, make sure that it's clean, dry, and intact. I would also want to check any catheters, check for urine output and color. From there, I would want to begin my head-to-toe assessment, starting with the patient's face and head. I would check for facial symmetry. I would also use a pen light and check in their mouth. If you could say ah for me. I would check to see that their mouth is pink and that they their teeth or dentures are intact. I would also check their eyes. I'm looking for pupil roundness, symmetry, and reaction to light. So I'm just going to look in your eyes. Thank you. All right, I would also ask the patient if they're having any changes with hearing. Have you noticed any changes with your vision or hearing lately? No. Okay. From there, I would work my way down to the patient's chest where I would auscultate. I'm listening for any, I want vesicular lung sounds, S1 and S2. I'm looking for the presence of murmurs, wheezes, or crackles. So I'm just going to go ahead and give you a listen really quick. In actual practice, I would be auscultating underneath the patient's clothing, but for this demonstration, I will be auscultating over his clothing. So I'm just going to go ahead and listen to your chest.
Okay.
You just take some breaths for me. All right, thank you very much. From there, I would work my way down and inspect the patient's abdomen. Again, we would be going under the clothing. I would be looking for any distension or wounds. From there, I would auscultate all four quadrants. Listening, we want normal active bowel sounds. So I'm just going to go ahead and listen to your stomach.
Okay.
All right, thank you. I would also palpate, feeling for any firmness or checking for any discomfort. Is it okay if I touch your stomach?
Mm-hmm.
Okay, and just tell me if anything hurts.
Nope.
Alrighty. So, I would also ask the patient about allergies. Sir, do you have any allergies?
Yes.
What do you have an allergy to?
Penicillin.
And what kind of reaction do you have?
My throat starts to close up.
Okay. And then I would also ask the patient, are you in any pain right now?
A little.
Okay. So when the patient responds yes to having pain, I would proceed to use the old CARTS mnemonic to try to narrow down my focus on what's going on with that. So can you tell me, when did the pain start?
Yesterday.
Okay. And where is the pain located?
Lower back.
In your lower back?
Mm-hmm.
Okay. How long does the pain last? Is it constant or does it come and go?
It comes and goes.
Okay. How would you describe the pain? Is it sharp, dull?
Dull pain.
Okay. And is there any aggravating factors to it? Anything that you do that makes the pain worse?
No, not really.
Okay. And is there anything that you do that makes the pain better?
No.
Okay. What about timing? Is there any part of the day that the pain is worse? After you eat, before you eat, anything like that?
Sometimes in the morning it hurts a little bit, but that's about it.
Okay. And then how would you rate your pain on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt?
I'd say about a 5 or 6.
Okay. So from there, I would just work my way down. We would do upper extremity inspection. I would check for range of motion. If you're okay, sir, I'm just going to touch your arm. If you could flex, making sure he has good mobility in his upper extremities. I would ask him some questions like, do you have any pain or tingling or numbness in your arms?
No.
Nothing? No joint pain or stiffness?
Not at all.
Okay. I would also listen for, or feel for his radial pulses bilaterally. And I would check the other side as well. And those are +2. I would also check for capillary refill bilaterally, and that is less than 3 seconds. I'm also going to be looking for clubbing or edema, which are both negative for this patient. Similarly, for lower extremities, I would ask the patient, do you have any tingling, numbness, pain in your legs?
No, not at all.
And we're going to check range of motion.
Okay.
Move your legs, good. No pain, anything like that?
No.
Okay. And similarly, we would check the patient's pedal pulses bilaterally, which are both +2. Again, we would test for capillary refill, which is less than 3. From there, that would about sum up the extent, or excuse me, on an actual patient, you would also do a back and posterior exam looking for any skin breakdown, wounds, pressure points. For the purpose of this exam, we won't be doing that. But from there, that would about sum up the bedside assessment. I would ask my patient, is there anything else you need before I go?
No.
Okay, I would also make sure that his bed is, once again, in a safe position, lowered as far as it can go, with one railing down. I would also make sure that he has his call light in reach. Thank you very much.